Welcome back for another deep dive. This time, we're going to get into some serious science. We're talking pharmacokinetics, the wild ride a drug takes from the moment it enters your body to its grand exit.
You've shared some pretty intense academic papers, all in Portuguese, no less.
Yeah, and I gotta say, it looks like someone's been hitting the books hard.
Well, get ready to untangle those complex processes of absorption, distribution, metabolism, and excretion.
Yeah, we're about to break down how medications actually work in the body, and trust me, you might just learn a few things that surprise you along the way.
Before we jump into the journey, the source makes the distinction between pharmacokinetics, what the body does to a drug, and pharmacodynamics, what the drug does to the body.
Okay, so that's a crucial point to remember. It's like two sides of the same coin, right? The drug's journey and its effects. But why does this distinction matter so much?
Well, understanding a drug's journey, its pharmacokinetics, that helps us predict how effective it will be,
Oh, I see.
what kind of side effects it might cause, and how individual factors like your age or genetics might even affect how it works.
So it's like having a personalized instruction manual for each medication.
You got it.
Okay, so let's crack open this instruction manual then and dive into the 4 stages of pharmacokinetics. Conveniently known by the acronym ADME, absorption, distribution, metabolism, and excretion. Have you come across this acronym before?
It's a pretty fundamental concept in pharmacology. It really helps break down the complexity of a drug's journey.
Right.
These 4 stages, they work together to determine what happens to a drug in your body, like where it goes, how long it stays, and how it eventually gets eliminated.
The source uses some interesting language to describe those cell membranes, words like barriers, gatekeepers, and corridors. It really paints a picture of how important these membranes are in controlling what gets in and out of our cells.
Absolutely. Those membranes, they're essentially the guardians of our cells and drugs. They have to navigate this intricate landscape to reach their targets. What's fascinating is that a drug's properties, its size, solubility, whether it even carries a charge, that all affects how easily it can cross these barriers.
That makes me think of those time-release medications. Is that an example of manipulating a drug's properties to affect how it's absorbed?
You're exactly right. Time-release formulations, they're designed to control the rate at which a drug is released and absorbed, allowing for a longer-lasting effect. This is particularly helpful for medications that need to be taken less frequently, or for those that might cause, unwanted side effects if they're absorbed too quickly.
Now, one concept that I found really intriguing was first-pass metabolism, where the liver acts as this metabolic powerhouse, filtering and processing anything that enters from the digestive system.
Right.
Imagine you swallow a pill. It gets absorbed into the bloodstream, heads straight for the liver, often even before it can reach its intended target.
Yeah, it's a remarkable process. It highlights the liver's just crucial role in drug metabolism. In some cases, a significant portion of a drug gets metabolized by the liver before it can even reach the rest of the body.
That explains why some drugs need a much higher dose when taken orally compared to an injection, right? The source mentions a few examples, and it really drives home the point that the route of administration can drastically affect a drug's effectiveness.
Yeah, it's a critical consideration in drug development and prescribing. Understanding first-pass metabolism helps determine the optimal dosage and route of administration for each medication.
Okay, so the liver is like a major player in this whole process. But the source also mentions these mysterious-sounding cytochrome P450 enzymes, or CYPs. What exactly are these CYPs, and what role do they play in drug metabolism?
CYPs are a family of enzymes that play a starring role in breaking down drugs and other foreign substances that enter the body. Think of them as specialized molecular machines that can modify drug molecules, making them easier to excrete.
So they're like the body's cleanup crew, making sure those drugs don't overstay their welcome.
Exactly. But here's where it gets even more interesting. These CYPs can also be influenced by other substances, including certain foods and medications. This can lead to what we call drug interactions, where one substance can either increase or decrease the activity of a CYP enzyme, potentially affecting how other drugs are metabolized.
That sounds a little risky. Can you give me an example of a common drug interaction that might surprise people?
Well, one classic example is the interaction between grapefruit juice and certain medications, like statins, which are used to lower cholesterol. Grapefruit juice contains compounds that inhibit a specific CYP enzyme, leading to higher levels of the statin in the bloodstream.
Oh, wow.
And that can increase the risk of side effects.
That's a good reminder to always chat with your doctor or pharmacist about potential food and drug interactions before starting any new medications.
Absolutely. It's always better to be safe than sorry. Now, going back to those CYPs and drug metabolism, It's important to understand that's not just a one-step process. The source describes two phases of metabolism, kind of like a tag team effort to process and eliminate drugs.
Two phases. That sounds intriguing. Can you break down what happens in each phase?
So phase one reactions, they're like the initial breakdown, where enzymes like those CYPs modify the drug molecule, often adding or uncovering reactive groups. Then phase two reactions step in, attaching molecule to the drug to make it even more water-soluble. This makes it easier for the kidneys to filter and eliminate the drug from the body.
So it's like a two-step process to get rid of something you don't want hanging around.
Precisely. And this two-phase process is crucial for detoxifying not just drugs, but also a wide range of other substances, including environmental toxins and even some of the byproducts of our own metabolism.
That's incredible. So we've talked about how drugs are absorbed, distributed, and metabolized. But what happens when they've served their purpose? How do they finally exit the body? That's where excretion comes in, right?
Exactly. Excretion is the final act of the pharmacokinetic play, the grand finale, where drugs and their metabolites are removed from the bloodstream and sent packing.
And the kidneys are the main players in this final act, right? They filter the blood and remove waste products, including drugs, through urine. But the source also mentions other routes of excretion, like the lungs, sweat, bile, and even breast milk.
That's right. While the kidneys handle the bulk of drug excretion, these other routes can play a role, particularly for certain drugs or in specific situations. For example, volatile anesthetics, they're primarily excreted through the lungs when we exhale, while some drugs can be secreted into breast milk, which is important for breastfeeding mothers to be aware of.
So it's not just a simple, like, in one end, out the other process. There's a lot more nuance to how our bodies eliminate drugs.
Absolutely. And understanding these different routes of excretion is crucial for predicting how long a drug will stay in the body and for preventing potential complications, especially in individuals with kidney or liver disease.
Now, something we touched on earlier was the importance of pH in drug absorption. The source really emphasizes how pH can make or break a drug's journey, especially when it comes to crossing membranes and being excreted. Can you elaborate on that a bit?
Think of it this way. The pH of a solution, whether it's in your stomach, your blood, or your urine, that affects the charge of a drug molecule. Some drugs are weak acids, meaning they tend to donate a proton and become negatively charged in a basic environment. Others are weak bases, meaning they tend to accept a proton and become positively charged in an acidic environment. This charge affects how easily a drug can cross membranes and be absorbed or excreted.
So it's all about those charges and how they interact with the different environments within the body.
Exactly. And this concept is particularly important in renal excretion. The pH of urine can influence how efficiently certain drugs are eliminated.
For example,
Well, the source mentions Gardinal, an anticonvulsant drug. Its excretion is influenced by urine pH. By adjusting the pH of the urine, doctors can sometimes enhance or retard the elimination of this drug, which can be helpful in managing overdoses or treating certain medical conditions.
wow, so it's like having a control dial for drug clearance? That's fascinating. So we've covered a lot of ground here: absorption, distribution, metabolism, excretion, and the importance of pH. It's clear that there are a lot of factors that influence how drugs move through the body and how long they stick around.
Yeah, and we've only just scratched the surface. There's a whole world of complexity within each of these stages, and that's what makes pharmacokinetics such a fascinating and important field of study.
Oh, before we delve deeper into those complexities, let's take a step back and think about the bigger picture. All this talk about absorption, distribution, metabolism, and excretion. It all boils down to one crucial aspect: dosage and drug administration, right?
Absolutely. Understanding those pharmacokinetic principles is essential for determining the right dose of a drug and how often it needs to be taken. It's about finding that sweet spot where the drug is effective but also safe.
So how do doctors figure out the right dosage for each individual? It can't be a one-size-fits-all approach, can it?
You're absolutely right. It's not a one-size-fits-all situation. Factors like age, weight, kidney function, liver function, and even genetic variations can all influence how an individual responds to a drug. That's where personalized medicine comes into play.
Personalized medicine. Tell me more about that.
Personalized medicine is all about tailoring drug therapy to the individual patient. It takes into account all those factors we just mentioned: genetics, lifestyle, overall health, to optimize treatment outcomes and minimize the risk of side effects.
That sounds like the future of medicine, using our understanding of pharmacokinetics to create individualized treatment plans.
It's an exciting field, and it's already making a difference in how we approach drug therapy. But before we dive deeper into personalized medicine, Let's take a closer look at those different routes of administration and how they can influence a drug's journey through the body.
That sounds like a great place to pick up in part 2 of our deep dive.
I look forward to it.
Yeah.
It's amazing how interconnected all these pharmacokinetic concepts are,
Hmm.
the pH of our body, the different ways drugs move across membranes, the activity of those CYP enzymes. It all paints this, complex picture of how our bodies handle medications.
Yeah, it's like a delicate dance with all these different elements moving in sync. But as you mentioned earlier, that dance can get disrupted when we introduce other substances, like that grapefruit juice,
Right.
which can interfere with drug metabolism. And, those drug interactions can have some pretty surprising consequences.
Absolutely. The example we discussed with grapefruit juice and statins is a classic one, and it highlights the importance of patient education, right? Many people don't realize that something as seemingly harmless as grapefruit juice can have such a significant impact on how their medications work.
It's a good reminder that we need to consider the whole picture, not just the drug itself, but all those other factors that can influence its journey through the body. And that brings us back to personalized medicine. How close are we to truly tailoring drug therapy to each individual?
We're making some incredible strides in that direction. The source alludes to this by mentioning genetic variations that can influence CYP activity. Just imagine being able to test for these variations and then adjust medication dosages or even choose alternative drugs based on an individual's genetic profile.
That would be incredible. Knowing in advance how your body is likely to respond to a particular drug, it could revolutionize healthcare. But let's go back to those CYP enzymes for a moment. The source gets into some pretty detailed explanations of their structure and function. It mentions something about hemaproteins and iron playing a key role in their ability to interact with drugs.
Yeah, those details might seem a bit technical, but they're actually quite fascinating. Essentially, CYPs are these complex protein molecules that contain iron, which is crucial for their ability to bind to drugs and facilitate their metabolism.
So those iron atoms are like tiny magnets attracting and holding on to the drug molecules.
That's a great analogy. And once that drug is bound to the CYP enzyme, a series of chemical reactions takes place, ultimately leading to the drug's breakdown.
And that breakdown process, that makes the drug more water-soluble, which means it can be excreted more easily, right?
Exactly. It's like attaching a little tag to the drug molecule, signaling to the kidneys that it's time to say goodbye.
Now, here's something that blew my mind when I was reading through the source. It mentions that there are over 50 different CYP enzymes identified in humans. Talk about a diverse workforce.
It's incredible, isn't it? And each of these CYP enzymes has its own specificities, right? Some are better at metabolizing certain drugs, while others handle different substances. It's like a highly specialized factory, with each worker having their designated task.
That makes those drug interactions even more complex, right? Because if one drug inhibits a particular CYP enzyme, it could potentially affect the metabolism of other drugs that rely on that same enzyme. It's like a chain reaction.
Exactly, and the consequences can range from reduced drug effectiveness to increased toxicity. That's why understanding these interactions is so crucial for prescribing medications safely and effectively.
So it's not just about the drugs themselves, but also about our individual genetic makeup and how that influences our CYP enzyme activity. It's like our genes are part of the equation when it comes to how our bodies respond to medications.
Precisely, and that's why personalized medicine holds so much promise. By understanding an individual's genetic predispositions, we can anticipate potential drug interactions and adjust treatment accordingly. It's like having a personalized roadmap for navigating the world of medications.
So we've talked about how drugs are absorbed, distributed, and metabolized. But the journey doesn't end there, right? What happens when a drug has done its job? How does it make its exit?
That's where excretion comes in, the final act of the pharmacokinetic play. It's all about removing the drug and its metabolites from the body, ensuring they don't accumulate and cause harm.
And the kidneys are the main players in this final act, right? They filter the blood and remove waste products, including drugs, through urine. But, as you mentioned earlier, there are other routes of excretion as well.
You're right, the lungs, sweat, bile, even breast milk can play a role in drug excretion. For example, some drugs are volatile, meaning they can easily evaporate, and these drugs are primarily excreted through the lungs when we exhale.
That's fascinating. So it's not just a one-way street from the bloodstream to the kidneys. Drugs can take different paths depending on their properties and how they're metabolized.
Exactly, and this concept of multiple excretion routes highlights the complexity of pharmacokinetics. It's a multifaceted process. And understanding those nuances is crucial for optimizing drug therapy and minimizing potential risks.
Now, we've talked a lot about how pH affects drug absorption, but it also plays a role in excretion, especially when it comes to the kidneys, right?
Absolutely, the pH of urine can significantly influence a drug's ionization and how readily it's excreted. For some drugs, manipulating urine pH can be a useful strategy to enhance their elimination, especially in cases of overdose.
The source gives that example of Gardinal, the anticonvulsant drug, whose excretion is influenced by urine pH. It's like having a fine-tuning knob for drug elimination.
Precisely, and it underscores the interconnectedness of these pharmacokinetic concepts. Everything from a drug's chemical properties to our individual genetics to the pH of our bodily fluids can affect its journey through the body.
Okay, so we've covered absorption, distribution, metabolism, and excretion. We've talked about those fascinating CYP enzymes and how they can be affected by other substances, leading to those sometimes surprising drug interactions. And we've touched on the importance of personalized medicine and how our individual differences can affect our response to medications.
It's a lot to take in, but it all boils down to this. Understanding how drugs move through the body and how our bodies process them is crucial for making informed decisions about medication use.
Absolutely. It's about empowering ourselves with knowledge so we can be active participants in our own healthcare. But before we wrap up this deep dive, there's one more crucial concept we need to explore: drug clearance.
Drug clearance is a measure of how efficiently the body removes a drug from the bloodstream. It's like a measure of how quickly the body can clean up after a drug has done its job.
And this clearance rate can vary depending on a bunch of factors, right? Like a person's age, kidney function, and liver health.
Exactly, and it's a crucial concept for determining dosage regimens. For example, if a drug has a slow clearance rate, it might need to be given less frequently or at a lower dose to prevent it from building up in the body and causing side effects.
The source mentions loading doses and maintenance doses. Is that related to drug clearance?
You're spot on. A loading dose is a higher initial dose given to quickly reach therapeutic levels in the bloodstream, especially for drugs that are slowly cleared. Then, maintenance doses are given to keep those levels steady over time. It's like filling up a bathtub. The loading dose is the initial rush of water to get the tub filled, and the maintenance doses are like the trickle that keeps it topped up.
Great analogy. So drug clearance is about how quickly the body gets rid of a drug. But there's also this concept of half-life, right?
Yes, a drug's half-life is the time it takes for the concentration of a drug in the plasma to decrease by half. It's another important factor in determining dosage intervals and preventing drug accumulation.
So a drug with a short half-life will be eliminated from the body more quickly than a drug with a long half-life.
Exactly. Some drugs have very short half-lives measured in minutes, while others can stick around for days or even weeks. This knowledge is essential for healthcare providers when they're deciding how often a medication needs to be taken.
So we've talked about absorption, distribution, metabolism, excretion, clearance, and half-life. It's a lot of information, but it all paints this fascinating picture of how drugs interact with our bodies.
And it highlights the importance of recognizing individual differences. What works for one person might not work the same way for another. We have to move away from that one-size-fits-all approach and embrace the complexities of personalized medicine.
Absolutely. Each person's body handles drugs in its own unique way, and understanding those individual variations is key to optimizing drug therapy. But before we get too carried away with personalized medicine, let's take a step back and explore those different ways that drugs can be administered.
That's a great segue into the next part of our deep dive. After all, the route of administration plays a crucial role in how a drug enters the body and begins its pharmacokinetic journey.
Let's unpack that in part 3. I'm curious to learn more about those different routes and how they can affect a drug's effectiveness. We've been on quite a journey exploring the intricacies of pharmacokinetics, haven't we? It's like we've been given this incredible map of how drugs move through the body, and we're uncovering all these hidden pathways and connections.
Yeah, it really highlights the interconnectedness of our bodily systems and how they work together to process and eliminate those foreign substances. What's fascinating is that these same principles of pharmacokinetics, absorption, distribution, metabolism, and excretion, they apply not just to drugs, but other substances we encounter as well.
You're right. It's like a universal language for how our bodies interact with the world around us. From the foods we eat to even the environmental toxins we're exposed to, it's all connected.
Exactly. Take food, for instance. The nutrients in the food we eat, they're absorbed, distributed, metabolized, and excreted, just like drugs. And our bodies They evolve these intricate mechanisms to handle a wide variety of substances, both beneficial and potentially harmful.
That makes me wonder, like, what happens when one of those systems isn't working at full capacity? Like, what about the liver? We've talked about its role as this metabolic powerhouse, but what happens when that powerhouse starts to falter, like in someone with liver disease?
That's a crucial consideration, and the source touches on this by mentioning how liver function can impact drug metabolism. If the liver isn't working properly, it can't break down drugs as efficiently. This can lead to a buildup of drugs in the bloodstream, potentially increasing the risk of side effects and toxicity.
It's like a bottleneck in this system, right?
Right.
Everything gets backed up because the liver can't keep up with those processing demands.
That's a great way to visualize it. And it highlights the importance of monitoring liver function in individuals taking certain medications, especially those that are known to be, potentially harmful to liver.
The source also mentions that age can influence drug metabolism, with both, like the very young and the elderly potentially having reduced metabolic capacity. Does that mean dosages need to be adjusted for these age groups?
You're absolutely right. Infants, for example, they have immature livers and kidneys, so they metabolize and excrete drugs differently than adults. Similarly, as we age, our liver and kidney function naturally decline, which can affect how our bodies handle
No,
medications.
it's like a personalized puzzle, figuring out the right dosage for each individual, based on their age, their health, and all those other factors we've been discussing.
Precisely. And that's where a deep understanding of pharmacokinetics becomes so crucial for healthcare providers. It's about using this knowledge to tailor drug therapy to each patient's unique needs.
Okay, so we've talked about the liver and kidneys as key players in drug metabolism and excretion. But the source also gets into some pretty technical details about those different transport mechanisms involved in drug movement across membranes: passive diffusion, active transport, facilitated diffusion, and even those efflux pumps. It's like a whole network of like molecular shuttles ferrying drugs back and forth across those cellular borders.
It's a beautifully orchestrated system, and understanding these transport mechanisms helps us predict how drugs will behave in the body. Will they be absorbed readily? Will they reach their targets effectively? Will they be eliminated quickly? Or will they linger? These are all questions that pharmacokinetic principles can help answer.
And this knowledge isn't just for healthcare providers, right? Understanding these concepts can empower us as patients to make informed decisions about our medications.
Absolutely. The more you understand about how drugs work in your body, the better equipped you are to have those conversations with your doctor or pharmacist and to advocate for your own health.
Now, before we wrap up this deep dive, there's one more concept I want to touch on: drug protein binding. The source explains how drugs can bind to proteins in the bloodstream, like albumin, and how this binding can affect their distribution and activity.
Think of it like this. When a drug enters the bloodstream, it can either float around freely or attach itself to a protein, like a little passenger hitching a ride. The problem is, only the free drug can actually exert its effects on the body. The drug that's bound to a protein is essentially inactive.
So it's like a reservoir of drug bound to proteins waiting to be released.
Exactly. And the ratio of free drug to bound drug can vary depending on factors, like the drug's properties, the concentration of proteins in the blood, and even a person's health status.
That makes sense. So it's not just about how much drug is in the body, but also how much of it is actually available to do its job.
You got it. And this concept of drug-protein binding adds another layer of complexity to pharmacokinetics. It's a reminder that drug behavior in the body is influenced by a multitude of factors, and understanding those factors is key to optimizing drug therapy.
Well, we've covered a lot of ground in this deep dive, from absorption to excretion, from those fascinating CYP enzymes to the importance of personalized medicine. It's been a journey into the heart of pharmacokinetics, a science that helps us understand how drugs behave in the body and how we can optimize their use for therapeutic benefit.
And it's a journey that doesn't end here. The field of pharmacokinetics is constantly evolving, with new discoveries and insights emerging all the time.
Yeah, it's a reminder that we're all lifelong learners, and there's always more to explore, more to discover, and more to appreciate about this incredible science that shapes our health and well-being.
Absolutely. It's been a pleasure diving deep with you into this fascinating world of pharmacokinetics.
Thanks for joining us on this deep dive. We hope you found it enlightening. Until next time, keep those brains curious and those questions coming.